So a friend made me a pair of shoes, and after about 4 or 5 months of wearing them, because I loved them, they were so good looking, that all of my knee pain went away, and I had like 15, 20 years of knee pain, and my hip discomfort, sometimes at night or laying in one spot for too long sitting. I had shin splints, I had Achilles tendonitis, I had plantar fasciitis in my feet, my big toe hurt, all on and off for 15, 20 years. And all of that went away, and I said, oh my gosh, I've got to get this, I got to let everyone know about this. But I didn't know why I had that pain in the first place, and I didn't know what it was about these shoes that changed it. And I told my friend who made the boots for me, and he goes, yeah, a lot of my clients tell me that their lower back pain goes away. And I was like, well, why? And he talked over my head. I didn't really understand it. Let me just read to you what happens when your arch gets weak, which is either high arch or flat arch. Here are all the problems. So if you have any of these, it's because you have a weak arch. And you need to get shoes, not necessarily ours, but you need to get shoes that fix it. And I'm going to explain to you what you look for in a shoe, okay? So if you have flat foot, high arch pain, like plantar fasciitis, if you have abductor hallucis strain, you have bunions, deformed toes, which are hammer toes or club toes. You know when your second toe to your big toe is taller? That's called a club toe. I used to have that, but my toe went back to normal again when I started wearing these. Big toe pain, bone spurs, Morton's neuroma, tarsal tunnel syndrome, which is heel and arch pain, nerve pain, ingrown toenails, corns, heel ache, ball of foot pain, navicular syndrome, which is foot bone pain, and then the ankle, that was just the foot. Easily sprained ankles is because of your shoe. Ankle pain, Achilles tendonitis, I had that. Tarsal tunnel syndrome, which is ankle pain, calf pain and tightness, shin pain, shin splints, anterior compartment syndrome, knee pain, which is patellar tendonitis, iliotibial band syndrome, which is the tendon going up to the bottom of the knee, to the side of the knee, and to above the knee or under the knee is the patellofemoral pain. ACL ruptures, MCL ruptures, hamstrings, pulled hamstrings all the time in the lower hamstrings, hip pain, lower back pain, osteoarthritis. All of those are caused, according to all the medical websites, are caused by having a weak arch. That's it. Your arch gets weak. I'm trying to make it super easy for everyone to understand, because this is going to change the world, the more people who can understand this. So basically all these years and all the studying, I got 10 Google Docs of all this information. I watched, I don't know how many videos, all the medical research, talked to orthopedists and foot doctors, podiatrists, and I interviewed them, and then finally I sat down with this doctor. And he'd been a foot doctor for 30 years. And I said, can I explain this to you and see if I get it right? I'm trying to make it so everyone can understand it. And I explained it to him, and he said, that's exactly right. And he clarified a couple things, but he said, that's exactly right. And then I showed him the boot. And I said, this is what fixed my pain. And I explained it to him. And he said, if everyone made shoes like this, he said, there wouldn't be as much of a need for orthopedists. But here's what I found out. Basically, and there's so many theories, and everyone's trying to sell you inserts and sell you surgeries and sell you all these things on all these videos, but they're not trying to fix the root of the problem. You guys, this is, oh my gosh, this is probably the most important part of the whole entire shoe. It's the shape. If you have a bad shape for your foot, you're going to have, your arch is going to get weak, and your on the insides will lean in, and then that messes up the whole entire rest of your knees, shins, ACL, hamstrings, all of that sort of thing. Your hip joint, imagine if you have the socket for your hip and you have the ball on your femur there, and imagine it's like this. Imagine it's all of a sudden like this. That's kind of exaggerated. So you wonder where all the hip problems come from, knee problems, all the plantar fasciitis, all of that sort of thing is right here. This is the shoe last. It's called a last, and you wrap the leather all around it. So this has a last on the inside. See that? Here's a last here, and it sits on here for 48 hours. So this last goes in, they wrap, they sew all of the upper, they put the eyelets on, they do all this stuff, and then they stick this in with steam and heat, and they get it up in there, and most places will wrap it around with a machine, but they can't with ours. They have to hand last this. It has to come around the form, and then it sits on here, and this sits in here for 48 hours, and it dries at air temperature, at just ambient temperature, and it has to do that for the leather to memorize this shape, the shape of the last. So check this out. This is the last, and here's where it's important. Dr. Munson, this is strange, Dr. Munson, he's a relative of mine, turns out. I didn't know this. This is really cool. We were already using the Munson last. He developed this shape for all of the military. But I'll go into that in just a minute. Check this out. Here we go. Check out this last. It's twisted. Okay? See that? So the heel is twisted. I'll show you that more in a minute. This is a twisted last. Alden has a twisted last like this, but it's not very common. Not everyone understands why it's so important. In fact, all boots from 1912 through 1970, for all military, across the board, all the armed forces used the Munson last. This is the last that Dr. Munson came up with for 4 years, from 1908 to 1912. He was a Yale doctor, a Yale graduate, medicine doctor guy, joined the Army, and they put him in charge of the shoe board. He developed a shoe board, got some people together. They tested different lasts and different shoes, the shape of the shoes, on 2,000 soldiers. And they had them march, they started off, had them march 8 miles one direction, rest for 24 hours, march 8 miles back. And they found out that 38% either couldn't finish the march, had bloody feet, blisters, were super in bad shape. They developed this, and after 4 years, thousands of different shoes and boots they've tried on different soldiers, x-raying them, and how is it with their pack, how is it with all these things, and they came up with this general shape. This matches the physiology of the body. This matches the biomechanics, how your foot moves and all of that sort of thing. Guys, this is so important. And he had several principles that we'll talk about with the shape and how you design a boot that's really good for the body. So check this out. If you don't walk right, if your toe gets pushed in, notice how this has a straight toe like that. It's pretty straight. If it doesn't have that, it's going to push the big toe in. Check this out. Here's a nice dress shoe, right? Here we go. Here's the Munson shape here. It's obeying the Munson principles of that shape. But actually, there are several generations of the last. They were more refined and more beautiful at first. We're using that style as opposed to the big bobbly toe one that was like the 6th generation. So here we go. Check this out. Here's ours, and here's the shape of other people's. If your toes are crammed in there, that's terrible for you. And what that does is it weakens the arch. It weakens the muscles. And when your toe is like pressed in like that, and you made a shoe for the foot to conform to, that's terrible. Dr. Munson said, never do that you make a shoe for the foot to conform to. You make a shoe that conforms to the foot. And so you get this toes being forced in. The Munson principles of the last is that it goes along with the shape of the foot. We made a shoe for the shape of the foot, not a foot to fit into the shape of the shoe. So this, you get a lot of fancy shoes and you get a lot of fancy knee problems, a lot of fancy knee braces, lots of fancy surgeries, hip, lower back, knee problems, all the plantar fasciitis, all of that stuff. The root of a lot of it, and I'm talking to podiatrists, reading all the websites, you can click on all the links on our site that talk about all of this from all the fancy medical places. This is one of the big problems. It pushes your toe in and it hurts you. So here's what our last does. It makes you walk the way you were meant to, as if you were barefoot. So what happens here? It makes you come down on the heel and then roll your weight along the outer side, not on the arch side here. When you come down, it makes you, and then when you get up here and it's time to shift all the weight, your foot rotates, your body weight rotates, your ankle rotates, so that your big toe can launch you off. and this makes you walk right. So this is the shape of the boot that very few people use these days, but it follows all of those principles of the Munson last. I weigh 230 pounds. Okay, I'm a little, could lose a little bit of weight, but my feet, so when I step on one foot, I have 230 pounds on one foot. When I'm standing here, I have 115 on each foot. But when I step, my foot spreads out. When I do it, it spreads. And this has a wide toe box so that it spreads. It allows for, and your feet can spread up to 1/2 inch. And all day long, if you're on your feet all day long, your arch is right here, it tends to flatten and extend out 1/2 inch. There you go. This is the last. We have a lot of 4th, 5th, and 6th generation lasts. I have a couple of those, but the toe is kind of bobbly, kind of thick for different purposes, and they made it different for the ease of manufacturing. But these, the 1st, 2nd, 3rd generation, were very orthopedic in shape because they matched your foot. They didn't make a boot for your foot to fit into and conform to the shoe. They made a shoe that conforms to your foot. As you see, there's no shortcut to making a quality boot. This boot takes forever to make. And it's not just because it's got a lot of parts. There are a lot of extra processes that you'll see in here that you've seen that just make it really hard to make. Now we have a black tongue in this one, just so you know, don't worry, they don't come with black tongues like a chow. They come with the regular leather, but we didn't have any for this sample here. But anyway, this is the boot, and we think you're gonna love it as much as I do.